we wait 1 or 2 minutes before we begin. Okay, so let's begin. Welcome, everyone. So we are very happy to be here today. So this workshop is organized by the European Network of National Contact Points for European Programs, Horizon Europe, programs for health specifically. So I'm Virginie Sivan. I am the coordinator of the National Contact Points for Health in France. And I am here together with Vania Rosas, who is the national contact point as well. And we will be very happy to welcome also our colleague from Nigeria, who will connect, I think, that at the end of this presentation. So, first of all, I would like to say that we can meet us. You can meet us at the booth number 14. So do not hesitate to visit us after this workshop. So the objective of this workshop is first to give you an overview of the European program on research and innovation and the call for proposals that in health and in particular in infectious diseases that are open today. But also very important to present all the European and international national contact points for health, people that can guide you through these different programs. And we will have the pleasure to welcome also our colleague Adamou Jiré-Bakari at the end of this session with the national contact point from Nigeria. So I give the floor to Vania Rosas from the Ministry of Higher Education and Research for the presentation. Thank you.
Hi, everyone. Thank you for being here at 1 p.m. Maybe you are a little bit hungry or you ate very fast. Just let me try to put my presentation. How does it work? Yes. I will talk to you today about Horizon Europe, and which is the program that funds different subjects, including health. What are the funding opportunities on infectious diseases that are already open and that you can apply for? And first of all, to let you know which are the national contact points, what are the objective, or to have national contact points around the world, how they can help you to your research, to your projects, and to your applications. I am, as Virginie said, national contact point of health in France for the French Ministry of Research. And this is a talk, we're talking in behalf of the network of health NCPs around Europe. So in this presentation, I will introduce what is Horizon Europe, what is the health cluster in Horizon Europe, what are the participation rules, the open calls that in the work program at the moment, partnerships to fund your infectious disease projects. How can we help you? The national contact points, the tools we have already in place, and other ways to fund your infectious disease projects. So Horizon Europe is the 9th Research and Innovation Framework Program. It goes from 2021 to 2027 and is the most ambitious research and innovation funding program ever undertaken. The budget of Horizon Europe is 95.5 billion euros, and the aim of Horizon Europe is to strengthen the EU's scientific and technological basis and the European research area, to boost Europe's innovation capacity, competitiveness and jobs, to deliver on citizens' priorities and sustain our socioeconomic models and values. This is the structure of Horizon Europe. It seems very complicated, but this is not, I assure you. Pillar 1 is the excellent science. Maybe you have already heard, I will try to show you, about these programs, the European Research Council, non-thematic research, mono-beneficiary, the Marie Curie actions, the research infrastructures. And on the Pillar 2, you can find the global challenges and European industrial competitiveness. This is divided in 6 different clusters. Cluster 1 is the cluster health, that's where we are national contact points. EDCTP belongs to cluster health for, within Horizon Europe. And Pillar 3, which is the Innovative Europe, with the European Innovation Council that can fund also health programs, the European Innovation Ecosystems, and the European Institute of Innovation and Technology. And from where it comes the health cluster in Horizon Europe, we know that Europe is confronted to different challenges in different areas, including health and aging, for example, environmental determinants and social determinants of health, different diseases, new emerging diseases, among others, and how to tackle these challenges, health challenges, is found in a document that is called the strategic plan. There is one strategic plan from 2021 to 2024, and another one that is being drafted from 2025 to 2027 that addresses the EU policy priorities, the key strategy orientations for research and innovation, and what we call destinations, meaning the impacts, the expected impacts, how the projects, the real research projects, should address these challenges. And this is implemented through the work program. This is where you can find the topics, the real topics that will be funded, the thematics, the health partnerships, and the cancer mission for the health cluster. What do you need to participate? Well, you need to set up a collaborative project, which is a consortium of partners that have to work together in a collaborative way. And the idea is to set up a consortium with a coordinator, which will be the main contact with the European Commission, and is responsible for the smooth running of the project and the good collaboration between all the partners. And also you can be a partner in the consortium. You can be responsible of a work package, but not only, you can also be just responsible for an activity within the project. Consortia, this is just an example, but consortia could be from 5 to 20 partners. It depends on the requirements of the topic that will be funded. The budget could be between 3 and 15 million euros, and these projects go from 4 to 5 years. There are different kinds of funding actions within the collaborative projects. The research and innovation actions that you will see it very often when you look at the topics, when you read at the topics, at the funding topics, you will see how it says this is a research and innovation action, this is an innovation action, this is a coordinated and support action. A research and innovation actions fund fundamental and applied research, and the funding rate is 100% of direct costs. The innovation actions are projects that are meant to develop a prototype or demonstrate a pilot for commercialization, and the funding rates are 100% for public partners and 70% for private partners. And the coordination and support actions that are shorter and less funded projects, but that fund measures to set up programs, design new infrastructures, pathways to different output, and the funding rates are at 100% of direct costs. You need to participate, you need to be a consortium of minimum 3 independent legal entities within a member state or different associated country, and at least one established in a UN member state. Every legal entity can participate, could be a research institution, university, SMEs, but not every legal entity have access to funding. So I will show you who will have access to funding in my next slide. To be eligible for funding, you have to be part of the 27 member states. Could be also an entity, legal entity from an associated country, and I added the list of associated countries here. UK has signed an agreement with Horizon Europe, so you can also have a partner in the UK. And please, if you have any doubt about the association of the UK and how to participate, you can contact directly the national contact points at UK, so they can give you more information on how to include these partners. Third countries that come from low and middle income countries, and I will show you in my next slide who are these low and middle income countries that can be eligible for funding. You have specific cases for the health cluster. USA can participate to a health cluster with the exception of the mission on cancer, and Switzerland that has no association agreement, but where Swiss partners can be included in the EC project, and they are funded by their national agency. This is the list. I won't read it, but just I highlighted all the countries from lower and middle income countries that can be eligible for funding in Africa. So if you look at the name of your country there, just you can participate at the Horizon Europe projects with the rules that apply, with the participation rules I just showed in my previous slide. So there are open calls in the work program already on infectious diseases, on the health work program for 2023 and 2024. The 2025 work program is under construction, and it is divided, the work program, in 6 different destinations that I won't detail, but as I told you at the beginning of my presentation, destinations are expected impact. That means that's what we expect from the projects to have an impact at the short and the long term. And you will see definitions in the strategic plan of every destination. And these same 6 destinations will be present in the new strategic plan from 2025 and 2027. There are calls open in the destination 3, destination on tackling diseases and reducing disease burden. And it is this is the definition of the destination. What were we expecting? To address, to better tackle and manage diseases on infectious diseases, including poverty-related and neglected diseases, and non-communicable diseases and rare diseases. This is the calls the call that I'm going to describe in my next slide is part of this destination, but in the next work programs, there will be other infectious diseases topics that will be open from 2025. So just be aware and ask your national contact points. There are 2 calls open and now, where deadline 11 of April, sorry, this in French, this slide, I just realized. 11 of April 2024, and 1 on host pathogen interactions and of infectious diseases with epidemic potential, that I will describe in detail in my next 3 slides. This is part of the Pandemic Preparedness and Response Program. And the aim of this call is to characterize host pathogen interactions with a view to inhibit viral replication, viral proteases, exit strategies, therapeutic antibodies and/or vaccines to target these viruses. The deadline is 11 of April 2024, so we still have time to design some projects. You still have time to design some projects. And the budget per project will be 7 to 8 million euros, and it's a research and innovation action. And the expected outcomes are to include scientific and clinical communities to know more about viruses and with epidemic potentials, and we show you a list of viruses that are eligible to this call, to better understand host pathogen interactions, to have address novel approaches for the prevention and treatment, and then access to experimental vaccine candidates. These are the list of eligible viruses for this call. Arboviruses, and the idea is to understand the documentalization of the viruses, how the viral surface protein works, the viral uptake in the host cell with regard to the topology and the dynamics of the host receptor, and the identification of receptor and legal subunits that could be targeted by preventive or therapeutic intervention. There are also, this is the one that is open already, so just go ahead and reread the complete text of the call. And there are partnerships also to fund your infectious disease project. The partnership, the institutional a partnership that is called Innovative Health Initiative, maybe you have heard about it. The EDCTP, of course, one of the institutionalized partnership, and there are other partnerships that you will see here, which are co-funded partnerships. That means there are the member states and the European Commission that fund these partnerships, and they all have their own schedule of calls opening, which is different from what you can find in the work program. Just a word on IHI, Innovative Health Initiative, that can also fund your infectious disease through the public-private partnership scheme within the strategic research agenda. There are no open calls on infectious diseases at the moment, but just to let you know, the infectious diseases get into the focus of the strategic research innovation agenda, because the focus is to prevent, intercept, diagnose, treat, and manage diseases, and a research supported by IHI should remain at pre-competitive level. So just to be aware that IHI could also fund your research on infectious diseases. So how can we help you? First of all, what are the national contact points? Because you have heard during this talk about national contact points, but what are they? We are ambassadors of Horizon Europe, and we have been nominated to spread awareness, provide specialist advice, and guidance on health research funding opportunities with Horizon Europe. In reality, I'm talking about health in this talk, but there are national contact points in the different programs within Horizon Europe. So if you have any question about another program, you can also contact the national contact points dedicated to other programs. In France, we are 3 national contact point members, and Virginie, who presented me and who hosts this session, that is the coordinator and the committee program representative of France. You can contact us in France to this generic address. We have also a LinkedIn, it's not exactly a website, or I don't know how to say, but we give all the information about the calls that are open and all the things we do, all the activities that we do. And then you can also subscribe to our mailing list to this web address. The website, we have a website dedicated to health within Horizon Europe, and the website is in French. And if you go to this QR code, you can go directly to the website in French. What we do is to inform, support, and raise awareness and advise all the community of research and innovation about funding opportunities on Horizon Europe and the health cluster, how to participate, if your idea is in adequacy with the topic that will be funded. We meet also with the project participants in B2B, just to be sure that they understood the philosophy of Horizon Europe, and also to discuss about their ideas. We organize training, webinars or seminars about, of course, the funding opportunities, but also transversal subjects, ethics, gender, dashboard, networking, etc. And we can also direct you to other funding opportunities in other health clusters, in other health programs and clusters if we know. We do not design the projects, and we do not read neither or comment projects that are going to be meant to apply for a topic. We are part of a consortium, a European consortium that is called the Health NCP Net 3. We are 17 partners in 17 different countries, but we are not the only national contact points in the world. We are the link between the applicants and the European Commission, and the idea is to improve the quality of proposal and the impact of projects funded on the cluster Health of Horizon Europe. We have created within the French national contact points and also within the European national contact points network a series of guiding documents to help you apply for your funding opportunity. There are guidelines through the HNN3. We have created guidelines for partner search, for pitch sessions, for brokerage events, for institutions from widening countries, and annotated templates for example, clinical trials. This is the link to go and look for your national contact point in your country. This is the interface. There are not all African, not all African countries have national contact points, but there are a lot of African national contact points in the network. So this is a website hosted by the European Commission. So just go there and look at your country, and you will find who to contact directly that has the local context. So you can also fund your infectious diseases through other programs that are outside of Horizon Europe and that we know because we have some collaboration with them, which is the program that is called EU for Health. Maybe you know it. And they also have a network of what they call national focal points. So if you have any questions on EU for Health and the topics and all the projects to come, just please connect to you can find all the national focal points in this website. And thank you very much. So I will leave the floor to our colleague from Nigeria. Is he? I don't know if he's connected. Mm-hmm. He will present the new NCP network in Nigeria. I take advantage, just if you have any questions, go to booth number 14. We are around and you can ask every question.
Yes, I am ready.
Yes.
Thank you very much for the opportunity to share our experiences on the Nigerian NCP network. The Nigerian NCP network was established in the second quarter of 2022 by the Tertiary Education Fund in Nigeria. By the way, the Tertiary Education Trust Fund is a fund that has contributed so much in the improvement in tertiary education in Nigeria in the areas of teaching, research, and community service. But it was observed by the fund that the research output of Nigerian universities was on the low side, and therefore the need to establish the NCP network so that researchers from Nigeria will be able to network with their colleagues in Europe and elsewhere in the globe. I was appointed as the NCP for Public Health, and my initial task was to identify sub-thematic areas in public health, and the following were identified. The first was health throughout life course, which encompasses maternal and child health, adolescent health, as well as aging. The second was non-communicable disease and rare diseases, which encompasses all non-communicable diseases such as obesity, diabetes, hypertension, cancers, hemoglobinopathies, and so on. The third sub-theme was imagine and reimagine infectious diseases, including poverty-related and neglected tropical diseases. This also encompasses the One Health, which includes people in veterinary medicine and so on. The fourth sub-theme was environmental and social health determinants of health. And the last but not the least was tools, technologies, and digital solutions for healthcare, including personalized medicine, drug development, and phytomedicines. Having identified these sub-thematic areas, opinion leaders in the sub-thematic areas were identified, and those willing were assigned roles as sub-thematic NCPs. So in addition to me as the NCP for Public Health, each of these 5 sub-thematic areas also had NCPs. These sub-thematic NCPs were formally inaugurated in February 2023. And what are the activities that we carried out since inception? We had several trainings that were organized by TED Fund for the NCPs and the sub-thematic NCPs on EU funding, Horizon Europe, and so on. After this training, the team identified research teams which were encouraged to submit proposals for evaluation by TED Fund, by the NCPs and the sub-thematic NCPs. These proposals were intended to be fine-tuned for submission for Horizon Europe funding. These teams will be trained later this month on developing European fundable proposals, as well as networking. It's also good to know that the Nigerian NCP network is now onboarded on the Horizon Europe portal, and we are therefore available for collaboration with our European partners. We are therefore eager to partner with researchers all over Europe in public health research. Our NCP network is fairly a young one, but fully active and promises to yield promising results. The contacts, email addresses have been provided, and you could also Google the Nigerian NCP network, and then the website of the Nigerian NCP will be available. Thank you for the opportunity once more to share on our activities. We are more than ready, especially in the area of infectious diseases researches, because as you know, we have a large population base, and we also have a large infection base. So we'll be very glad to work along with our partners from across the globe, especially those in Europe. Thank you for the opportunity, and thank you very much.
Thank you very much. And we are open for questions. If you have any question.
Yeah. If you have any question, there is a microphone.
Hello.
Here. Any question? Anyway, don't forget that we have a booth here, so you are welcome to. It's a booth, it's the France booth, it's just next to the EDCTP 3 booth. So do not hesitate to come and see us. and especially if you want to identify your contact points in your country, we can help you to identify this person. So this was really a short introduction to the European programs, but as you see, it's a lot of countries can be funded through this program, not only European countries, but also African countries. So really do not hesitate to come and see us so that we can explain in much detail what are this program about.
Thank you very much.
Thank you.